So you wanted to know more about collapsed lungs, huh? Well, let me tell you, digging into these medical journals, this stuff is fascinating. We're doing a deep dive on primary spontaneous pneumothorax, PSP for short.
Exactly. And we'll make sure it all makes sense, even if, medical jargon isn't your first language.
I appreciate that because honestly, PSP, it kind of sounds like something, well, made up, right? But from what I've been reading, it's like a serious thing where your lung just collapses, often without any warning.
That's the heart of it, yeah. PSP is all about a lung collapse that seemingly comes out of nowhere. Usually no history of lung problems or anything. Well, at least not any obvious ones.
Okay, see, that's what's so interesting to me. It's not like someone with, years of lung disease. This
Yeah.
could just happen.
Well, not to anyone exactly. It's not totally random, if that makes sense. Most times, there's some underlying weakness in the lung tissue, even if it's never been, diagnosed.
So it's more of a hidden vulnerability then, something that like finally gives way.
That's a great way to put it. Think of it like a balloon, right? With a tiny flaw. Might look totally fine when it's blown up, but that weak spot's just there, waiting for, pressure to become a problem.
Okay, that makes sense, yeah. So it's not the blowing up the balloon part, but that almost like invisible weakness that leads to the pop. And in this case, the pop is a collapsed lung.
Precisely. And just like with balloons, some people are, well, predisposed to these weaknesses, and certain factors can really make them more vulnerable.
And that makes me think about the demographics we saw in the research. For example, we found that PSP is way more common in men. I mean, the numbers in the US alone are kind of startling, over 7 times higher in men than women. What could explain that kind of discrepancy?
That is a great question, and one that researchers have been, well, trying to answer for years. The why is complex, but one factor definitely stands out more than the others.
Let me guess, it has something to do with lifestyle choices.
You're on the right track. Let's just say those invisible weaknesses in the lungs we talked about. They become a lot more common when you introduce a certain habit.
Okay, you're about to say smoking.
Yeah. Smoking is, well, it's a huge risk factor. And yeah, those numbers about men being more susceptible, a lot of that comes down to, well, smoking habits.
Yeah, the research we have cited that heavy smokers have a 102 times higher risk of PSP compared to non-smokers. Wow, that's alarming.
It really is. And it all goes back to that balloon analogy. Smoking basically weakens the lung tissue, creating these tiny flaws, the ones that make a collapse more likely.
So it's like those microscopic tears you get in an overstretched balloon. You might not even see them at first, but they make it so much easier for the whole thing to just burst.
Exactly. Smoking makes the skin of the lungs, those delicate air sacs, more fragile, more prone to, well, rupture.
That's a pretty powerful visual. Okay, so smoking is like enemy number one here. But what about those who've like never touched a cigarette in their life? Are there other risk factors that they should be aware of?
Oh, absolutely. Family history, for one, plays a role. If someone has, a close relative who's experienced a spontaneous pneumothorax, they might be at higher risk.
Yeah, that makes sense. Genetics, they often play a part in these sorts of things.
Right. And there are also some specific genetic conditions that can up the risk, like Marfan syndrome, for example. It affects connective tissues all over the body, but also in the lungs.
So it's not just about the lungs themselves being weak, but like the connective tissue that helps hold them together. Is that what you mean?
Precisely. And here's an interesting one. There's even a possible link between endometriosis and an increased risk of PSP.
Endometriosis. Now, that's not something you hear every day, in this context, at least.
True. It's definitely an area that needs more research for sure, but some studies have shown, suggested a connection. It's like a reminder that even, well, seemingly unrelated conditions can sometimes have overlapping risk factors.
Wow, that's fascinating. Really highlights how interconnected our bodies are. But, okay. We've talked about who might be vulnerable, but how does this actually play out in real life? If someone is at risk for PSP, what are the warning signs?
Well, imagine this.
Yeah.
You're just going about your day, right? Maybe reading a book or watching TV. And then suddenly, bam, this sharp chest pain hits you, seemingly out of nowhere. That's a very common way it starts.
Oof, yeah. Wow, that sounds really painful. I can imagine it would be terrifying to have that happen out of the blue. Is it always like a drop everything, call 911 immediately kind of pain? Or can it be, I don't know, more subtle?
It's a good question, and that's actually really important. It can vary quite a bit. The The severity often depends on, well, the size of the pneumothorax, how much air has actually leaked into that space, between the lung and the chest wall.
Ah, okay.
A small leak might just be like a nagging discomfort, you know what I mean? But a large one, that's going to get your attention.
So it's like if you want to use a real world analogy here, the difference between a small leak in your tire versus a full blown blowout.
Exactly. And in those more serious cases, shortness of breath is another like major warning sign.
Okay, that makes sense. So sudden chest pain and shortness of breath, those are like the red flags to watch out for. But how is PSP actually diagnosed? What do they do?
A lot of people are surprised how straightforward it often is. A simple chest X-ray can usually spot a pneumothorax. It'll show that clear separation, where the lung is pulled away from the chest wall.
So no need for some like crazy complex lung decoding technology.
Thankfully not. A standard X-ray does the trick in most cases.
Yeah.
Though I will say the research we looked at also mentioned something called a tension pneumothorax, which that sounds a lot more serious.
It does. Yeah, that does sound kind of worrisome. What makes that type of pneumothorax, I don't know, different?
So it's a situation where basically the air that's leaked into the chest cavity, it starts to build up pressure. And that pressure, it can actually start to impact other organs, like the heart, for example.
Oh, wow.
And that's when it can become, a real medical emergency.
Yeah. That sounds like something you definitely want to catch early.
100%. Which is why, going back to those warning signs we talked about, early diagnosis and treatment, really key here.
Speaking of treatment, what does that actually involve? Like if someone is diagnosed with PSP, what happens next?
Well, like a lot of things, it depends in this case on the severity. A small pneumothorax, it might resolve, entirely on its own,
Yeah.
maybe just with a bit of monitoring and some supplemental oxygen. Think of it as like a chance for the lungs to, rest and repair.
Oh, okay. So like a bit of like enforced relaxation for the lungs.
Exactly. But for larger pneumothoraxes, doctors might need to intervene a little more directly.
And what does that intervention look like? What do they do?
So one option is, well, they call it needle aspiration, but basically it means using a needle to like draw the excess air out of the chest cavity, like almost like letting air out of a tire, to reduce the pressure.
And that helps the lung like reinflate.
Precisely. Sometimes a chest tube might be needed. It is, a bit more invasive, I suppose, but it allows for a more, well, controlled way to drain the air and let the lung re-expand.
And in those like more extreme situations, is surgery ever on the table?
Surgery is usually saved for those situations where the pneumothorax keeps, recurring, or if there's a persistent air leak that they can't seem to close, or in other cases, people in professions where a sudden collapse would be really dangerous, like pilots, for instance.
Oh, right. Yeah.
The surgery itself is often, well, it's often minimally invasive these days, and it basically aims to like patch up any weak areas to prevent future collapses.
So it's about like addressing the root cause and then sort of like reinforcing the lung to prevent it from happening, again and again.
Exactly. And that brings us, full circle back to prevention, which, as always, is the best medicine.
Yeah, couldn't agree more. And it sounds like just, from what we've discussed, being aware of those risk factors, especially, smoking, that's huge.
It really is. It's a good reminder, even though we're talking about a relatively uncommon condition here, the choices we make each day, those can have a real impact on our lung health.
Well, this has been, wow, really, really insightful. We've covered so much from like the signs that are so subtle all the way to treatment options. So thank you, a huge thank you for, guiding us through all of this. This is complicated stuff.
Happy to do it. Always love, digging into these fascinating corners of medicine.
And for everyone listening, we hope this deep dive has, given you a much better understanding of PSP. And hey, remember, knowledge is power, especially when it comes to our health, right? Until next time, stay curious.